the number one need or wish from my older patients almost always revolves around I love or my goal is to age independently for as long as possible and to
Mhm.
do it in my home for as long as possible. And I think no matter who you are or where you live or what your family situation is, I think it's always there's some truth to it applying across the board. Your physical therapist will likely end up being your best friend if that's your
Mm.
goal because they will keep you moving, they will keep you independent, and they will keep you living in the home that you choose to for as long as you can possibly maintain that. Obviously, time catches up to everyone, and there's nothing we can do stopping the aging process completely. But if you think about being able to take care of yourself and bathe yourself and cook your own meals and change your own clothes and getting yourself out of bed and into the shower and using the bathroom, these are all things that we do day in, day out, every single day with patients. And it's sometimes very simple things like, for example, going back to falls, people sometimes aren't allowed to age in their home because their house becomes a very dangerous place. A
Mhm.
physical therapist can look at your house and make it safer for you.
Hey everyone, this is Jonathan Marx from GoToHealth. Hope you're doing well today. The show today is for our older Americans or for those who care for older Americans. As the leading cause of injuries and injury-related deaths among older Americans, falls present a serious and growing health concern. Falls often lead to prolonged pain, broken bones, hospitalizations, sometimes, unfortunately, even death. Falls are not only harmful to patients, they're also a significant burden on the healthcare system. And according to the CDC, annual costs associated with falls are projected to rise to 100 billion by the year 2030. But thankfully, with the right intervention, falls are preventable. The introduction of the SAFE Act in the U.S. Senate and the Congress marks an important step towards improving patient access to physical and occupational therapy and protecting older Americans nationwide from preventable falls. This legislation will allow our older population to access essential preventative care with no out-of-pocket costs, all while enabling improved independence, well-being, and quality of life. If passed, the SAFE Act would allow Medicare beneficiaries to receive a no-cost falls risk assessment from a physical or occupational therapist as part of their annual wellness visit. We highly recommend that you contact your representative at the federal level, either in the House or Senate, and let them know you support the SAFE Act. Talking with us about this today is Nik Patel, physical therapist and executive director of the Alliance for Physical Therapy Quality and Innovation, or APTQI. You can learn more at aptqi.com. We want to keep bringing you the stories and insights you love. Help us out, please, by leaving a 5-star review on YouTube, Apple Podcasts, or Spotify, or wherever you're listening to us. It helps other dedicated listeners like you discover the show. Thanks in advance. So, welcome to the show, Nik Patel. How are you today?
I'm doing great. How are you?
Good, thank you. So, you're urging lawmakers in Congress to support the Stopping Addiction and Falls for the Elderly. It's called the SAFE Act. What will the bill do, and what's needed for the bill to pass in Congress?
Well, what the bill would do is it would give Medicare beneficiaries a new benefit. So you guys are probably pretty familiar with a lot of the wellness or annual wellness benefits that Medicare beneficiaries receive currently. Those are things such as screenings or tests that are made available at no cost to the Medicare beneficiary. And the
Mhm.
reason they're no cost is because if we catch some of these ailments early, chances are that the patient will be better off, will spend less money as a system, and things are it's a win-win situation. So what we typically see right now is once a year, a Medicare patient can get their blood work done because, let's check your A1C. Maybe you are showing signs of diabetes. We catch it early, you'll be better off. Or
Right.
maybe we should provide colonoscopies at no cost to the patient. That encourages them to do that because we catch the colon cancer early, you have a much better outcome and we have a lot less expenses. Well, one of the things that the SAFE Act does is sort of put falls on the same category as some of those other conditions. What people don't realize is falls are the number one cause of death, injury, and fracture in people who are 65 in our country.
I didn't know
And when you
that.
think, yeah, it's surprising to a lot of people, but it's the number one cause of hip fracture, risk fracture, number one cause of traumatic brain injury. And if we have such a problem with the number of people who falls, and naturally you look at the cost, and the cost is astronomical as well. We spend $50 billion a year in medical costs on falls.
Wow.
And the slope of that curve is pretty steep. So by the end of this decade, by 2030, the CDC says we'll be spending $100 billion a year on falls. And so what the SAFE Act does is say, let's have every patient at one time per year annually be able to access a fall risk assessment at no cost to them. So if we are able to catch a patient who is in danger of having a dangerous fall that causes an injury ahead of time, maybe we can prevent it. And then the more of those we can prevent, we improve quality of life and obviously decrease some of that medical cost. So if you are a Medicare beneficiary after the bill passes, you will go to your physician for your annual wellness visit, and like you normally do, if you tell that physician, yeah, I tripped and kind of fell in the last year. I didn't think anything of it. Maybe I'm just clumsy. The physician says, no, you know what? You should go and get that fall risk assessment done by your physical occupational therapist. And by the way, there'll be no cost to you. Just like they'll say, yeah, I have a family history of colon cancer. That physician might say, you should go get a colonoscopy done. But don't worry, it'll be no cost to you. I really think you should get this done. It'll put it on par with those things. And
Great.
what we need to do to make it pass, to your second part of your question, it's currently there's a bill in the House and the Senate for the SAFE Act. And what we're trying to do right now is get enough support from each chamber to get it to a committee vote.
Great. So what people should do is get in touch with their representative and support the SAFE Act. It's called the SAFE Act. Now it stands for Stopping Addiction and Falls for the Elderly. Nick, are you familiar at all with the addiction issue that's being addressed here? What's the addiction problem in seniors?
Yeah, absolutely. So the reason the addiction is included in the title is because what we see goes back to the point I made earlier. It's the number one cause of wrist fracture, hip fracture, and traumatic brain injury, which leads to headaches quite often. Well, all of those conditions and injuries are highly correlated to opioid use
Ah,
in people with falls. So we did some claims analysis when we were creating the bill, and we said, let's take people into two categories. The people who have fallen and serious enough to receive medical attention. So now there is a claim history for them and there's documentation. And we'll put them in two categories, the ones who had physical therapy after the fall and the ones that didn't. And not only were we able to track the claims for medical care, but we were able to track, hey, let's talk about were they ever readmitted to a hospital or emergency room for another fall-related diagnosis? And by the way, had they ever filed a claim with Medicare for an opioid prescription? And
mm.
so what we found was the group that had therapy afterwards had a much less likelihood of being readmitted to a hospital with a fall diagnosis, which was great. But then they also had a 50% less likelihood of ever filling a opioid prescription at their
Oh,
pharmacy.
wow. Interesting.
So you're talking about significant reductions because that bone pain that you get when you break a bone or that those headaches that you get after you've hit your head during a fall sometimes lead to those very dangerous drug prescriptions that are very difficult to get people off of.
Got it. Thank you for explaining that. I appreciate that. So, you're the executive director of the Alliance for Physical Therapy and Quality Innovation, and people can learn more about you at aptqi.com. Tell us about your organization. What do you folks do?
Well, our organization is it's kind of funny. It's a collection of physical and occupational therapy providers from that operate all across the country. And the reason why I say it's funny is because all of our members actually compete against each other every day of the week. However, they all join this alliance because they want to do something for the greater good in terms of like whatever we can accomplish for our patients will be good for all of us, for every member in there. So I don't think it happens very often in very many fields. I kind of use the example. It's sort of like if McDonald's and Burger King and Taco Bell CEOs all got together once a month to talk about how do we make the quality of food better.
Uh-huh.
Obviously, it doesn't happen because their food is terrible for you. But it is what happens in therapy. All of our competitors get together once a month and we talk about how we can deliver better care and what's better for patients and what's better for access to care, even though they actually compete against each other all the time.
Now, can you tell us what is APTQI working on these days?
So a lot of things that, again, are always geared toward what's best to for the patient to access our services. So we kind of attack things on three different fronts, either the payer side, the government side, or regulation side. So on the payer side, you may see your listeners may encounter this problem a lot where we like to say therapy is very affordable to the system. Like, we don't do surgeries and we don't do costly injections and imaging and radiology. So that's really low cost to the system. However, when you, as a private patient, and if you go to a therapist, it's not low cost to you. You get this copay every single visit that you go, and you see your therapist sometimes 12, 13, 14 times, especially if you're going there after a surgery. And then you pay 30, 40, 50, $60 each time you come in. It gets to be very expensive for you. So one of the things we're trying to work on is therapy. If therapy is low cost to the system, it should be low cost to the patient. You want to encourage patients to access the lower cost treatment pathways that are available to them. And we should not be charging patients such a large share of the therapy payment. If you could have a surgery, the patient may be out their portion $300 or $100, and then insurance is covering, thousands of it on their side. But with
Hmm.
therapy, that's not the case. The patient actually bears a great percentage of the responsibility to therapy, and we think that discourages use. So we're working on that, working on ways that reduce burden for therapists, that take away from actually treating patients. There's paperwork we got to fill out, there's documentation requirements. We're always trying
Hmm.
to decrease that burden. And then in terms of, laws, like I said, the SAFE Act kind of falls into which laws can we pass that give patients better benefits to not just be treated after injury, but maybe actually obviate the need for the injury in the first place, prevent it by viewing their therapist more as the primary care for anything musculoskeletal.
Got it. Do people need a reference from their doctor to see a physical therapist, or can they just go straight to a physical therapist?
Well, every state's a little bit different in terms of how long you can go to your physical therapist without a referral from a physician in pretty much every state. How
Okay.
long you can do that before you need a referral depends on the state you're in. Each practice act is slightly different. And then if you're a Medicare beneficiary, you do not need the referral to see the therapist, but your therapist will eventually need a plan of care signed by a physician whose care you're under to get reimbursed from Medicare.
Got it. What should my older listeners know about the importance of seeking physical therapy as they age? Why is that important?
I will tell you that I'm a therapist myself. I should have said that. And I will tell you from my experience of treating Medicare beneficiaries for a good number of years, the number one, if I could, condense it down to the number one need or wish from my older patients, almost always revolves around, I love, or my goal is to age independently for as long as possible and to
Hmm.
do it in my home for as long as possible. And I think no matter who you are or where you live or what your family situation is, I think it's always there's some truth to it applying across the board. Your physical therapist will likely end up being your best friend if that's your
Mm.
goal, because they will keep you moving, they will keep you independent, and they will keep you living in the home that you choose to for as long as you can possibly maintain that. Obviously, time catches up to everyone, and there's nothing we can do stopping the aging process completely. But if you think about being able to take care of yourself and bathe yourself and cook your own meals and change your own clothes and getting yourself out of bed and into the shower and using the bathroom, these are all things that we do day in, day out, every single day with patients. And it's sometimes very simple things, like, for example, going back to falls. People sometimes aren't allowed to age in their home because their house becomes a very dangerous place. A
Hmm.
physical therapist can look at your house and make it safer for you.
Mm.
We need to move these rugs out of the way. You have some of these power cords in the ground. Let's put a light right next to your bedstand so when you get up in the middle of the night, you're not walking around in the dark. Let's adjust your toilet to where the seat's a little bit higher so it's easier for you to get on and off. And that allows you to stay in your home for longer. And these are things that therapists do every day. And so if I was an aging American, I would say your therapist is your best friend if aging in your home and being independent for as long as possible is your goal.
So I can get a physical therapist to come to my home. Is that what you're saying? It sounds like it.
Correct. Yeah, so people think about therapists always in hospitals, but we actually work in a lot of different settings. There's therapists who will come to your homes. There's therapists who work in office buildings that you can, access just like you would in an outpatient or office space provider. There are ones that are in skilled nursing facilities. So we work in quite a few different settings.
Great. And if you don't mind my asking, for people who don't know, when people do get a physical therapy appointment, how does that make them more able to be safe in their home? Can you give us some examples?
Yeah, sure.
What do you work on in the body that makes it safer?
So a lot of that has to do with assessing your balance systems. So a lot of your balance comes from your inner ear. And you get conditions called vertigo sometimes, which makes you feel like you're very unsteady when you're walking. And sometimes it's just a matter of your balance can be improved by your therapist prescribing some balance exercises that are very specific for whatever you're deficient in. We can give you exercises to just make you stronger. We can show you how to get, like, a lot of times the transitional activities are where you fall, getting out of the bed or off of a toilet or off a chair to standing. We can show you how to do those things, but doing it a little bit easier. Like, use your armrests on your chairs when you stand up, or use some install some grab bars in your bathroom. But there's plenty of ways we can break down movements for you that isolate the most dangerous movements for people in their home and
Mhm.
show you how to make that movement safer.
Great. Anything else before we close? What question haven't I asked? It's my favorite question. What question haven't I asked that I should have? Or what message would you like to leave with people today, Nik?
I think the message that I'd like to leave with folks is you don't always have to chalk up everything that happens to you as you get older as something that's inevitable and can't stop father time, I'm getting older. Exercise works for you as you get older. Resistance training, balance training, some common sense modifications are all things you have access to if you go see your occupational and physical therapist. And you absolutely can slow down some of these changes that are happening to your body. Just speak with a professional and see what works for you.
Great. That's a wonderful message. Thank you. We've been talking with Nik Patel. He's a PT, a physical therapist, and the executive director of APTQI. That's the Alliance for Physical Therapy Quality and Innovation. They are supporting the SAFE Act, which is, as I mentioned before, proposed Senate Bill 2612 and companion bill in the House 1171. Contact your representative to support this legislation, as is Nik and many other organizations. The alliance, for which he's the executive director, unites small, medium, and large physical therapy practices to advocate for the physical therapy profession in the areas of payment reform, quality initiatives, outcomes, and innovation projects. Again, you can learn more at aptqi.com. And before we go, just a quick reminder, if you like what you've heard today, please leave us a 5-star review on Apple or Spotify or YouTube, wherever you're listening to us. It helps keep this content free and reaching the right people just like you. Thanks again for being with us, Nik. It's been a pleasure.
Appreciate it, Jonathan.
Good. And remember, as we say at the end of every show, this has been Jonathan Marx and Go to Health. Bye bye. We'll see you again next time. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marx in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at gotohealthmedia.com. See you next time, and remember to elevate your life with Go to Health.